Hi all, this is a quick introduction to the revised DPART process that will be launching on July 21st. Goals of the process are going to be to improve discharge information for our patients, to improve our compliance with regulations, to standardize our education for antipyretics in the department, and to aim to prevent patients from going home with the incorrect discharge instructions or without instructions at all. Primary new elements are revised DPART document for MDs, our antipyretic education by our RNs, and an increased role by the ASRs as a final discharge checkpoint. As you can see here, this is the new one-page summary. It has a sort of more comprehensive approach in the first page just to get the most salient information to patients in a more reader-friendly format. Specifically, we now have less demographic information at the top of the page, provide the patient's weight at the top of the page, and we have prescription information that's in a more reader-friendly format that we'll be printing up as well. The one thing of note on the prescription information is that there is sort of a key preposition that is missing that for families who might be confused it should be noted. So you can see it reads one application topical twice a day, 5-day. So the 4-5 days is missing. The CHAMPS team is working on changing that, but in the meantime we can help families to understand it if they might be confused. We also have a new results box, which is going to be something that you can click onto to provide free text comments about the key results of the patient's course while in the department. It's not intended to be comprehensive, but really is just going to be highlighting important results. The mychildrens.org portal is going to be a resource for many families where they can get all of their results, and their PCPs will also have comprehensive results. So the comments here should just be specific, and we want them to be as specific as possible to avoid inaccurate interpretation. Trainees will need guidance regarding this step of the DPART document. In particular, avoidance of defining the results as normal is going to really be sort of a good principle and to prevent providing confusing information for patients. So for example, a CBC that had been performed just for a neutropenia evaluation, if in the results section it's indicated that CBC was normal, may neglect to sort of communicate to the family that in fact a very low MCV had been present on the CBC. So a more specific comment such as WBC without neutropenia is going to be ideal. Additionally, in a scenario where patients come in for a CT for head trauma, the CT normal and the results may be confusing for a family if later it's noted there was actually some mucosal thickening that hadn't been reported. Preferable just to state head CT without intracranial bleeding, as this was the focus of the evaluation and was sort of felt to be the clinically significant portion of the results. Radiology results that are preliminary should be noted as well. For follow-up instructions, we have two options. You can free text in the follow-up comments area, similar to sort of what we do now in terms of follow-up plan and specific phone numbers. We also have a checkbox option in the follow-up tab that can be utilized. Previously scheduled outpatient appointments are also going to be visualized on the DPART document as well for visits that were scheduled in our system. Here you can see on the same screen that we use to fire the visit-specific discharge instructions. You can then click onto the follow-up tab at the top portion, and this is going to bring you to the follow-up screen. There are a variety of options you can use here. You can either select a quick pick, which will allow you to select the basic follow-up with your primary care pediatrician within 1 to 2 days. You can also free type in specific names of physicians. It doesn't actually accurately provide information for clinics, and we're working with the CHAMPS team to have those clinic phone numbers as quick pick options. You can also just type in free text for clinics if you would like, and they will come out as well on the one-page summary. So in terms of how this will sort of present, this would be if you had selected that one quick pick with the follow-up with your primary care in 1 to 2 days, and it will be indicated here. Additionally, here you can click into the comments box and you can free text any information you would like. And you can see at the base of every page there's going to be information about how to register for the portal, so people do have access to their information for those people who have access to the internet. We will still have our diagnosis-specific education information. It will print out on the following page after our page break. And one added bonus of the new DPART document is that there's going to be a school note that will print out after a page break with every single patient encounter. And you can see Tony Hogenkamp came up with a very nice checkbox format that will be quite user-friendly. In terms of PD-PALs, physicians, given that they are the primary prescriber of medications, are going to be responsible for providing PD-PALs to patients receiving new prescriptions. Sheets for the 10 most commonly prescribed medications are available in folders in all the team areas, and PD-PALs can be printed for any other medications from Lexicomp. We're working on an IT fix as we realize this is a cumbersome process, but for the moment this is our best option. In terms of Lexicomp, because a lot of people actually aren't incredibly familiar with its use for PD-PALs, Lexicomp can be pulled up in our system, and by clicking on to the patient education area, you get to this screen. You can then type in the medication that you're interested in getting information for, and you will get the patient education screen where there are a variety of options for all the medications. You can select the leaflet preview, which will bring you to a screen with the PD-PALs, and then it can be printed out. Feedback on the document is welcome. We plan to really continue to improve it to provide meaningful discharge information for our patients. Just quickly, I want to review the non-MD parts of the new process. Our RN team is taking on providing acetaminophen ibuprofen teaching with every patient, and patients will be going home with medication education sheets for both medications that can be used during home use. We're hoping this really helps to improve their understanding of accurate dosing. These medication education sheets will be included in every patient chart. And our ASRs have been willing to take on an increased role at the moment of discharge to really perform active ID confirmation to ensure that patients are in possession of the correct discharge instructions. And they're going to also help us to track which patients are receiving PD-PALs and which patients are receiving the antipyretic education sheets so that we can help to identify where we need more resources to help with improving these parts of our process. I want to thank all the members of the DPART process group for all their time and effort, and look forward to hearing from you guys about how it's going. Thanks so much.